A very good afternoon, everyone. Hope everyone is keeping fine and safe. My name is Udit Sakhuja, and I welcome all of you for on one of its kind of interaction or a dialogue initiated by Doc Mode, GAPSULES. GAPSULE is a interaction between pharma companies and medical practitioners. Understanding the knowledge gap, a first of an industry dialogue series, which has an aim to bridge the knowledge gap between the medical practitioners and pharma industry for the better treatment outcomes. We have seen in the past sessions of Capsule the disruptive changes which has come in the during the pandemic time and what are the key learnings we have taken forth further. Today's session is more or less related to that, and this is a second edition where we have elite medical practitioners where we will have an interaction which talks about what are the key things which has been changed, what are the intervention what pharma industry has applied to make sure there is a consistent marketing initiatives to provide better learning options, to provide better learning insights in the medical pharma, and also to have minimizing the right gaps, or still there are gaps which can be worked upon so that there is a consistent platform which can increase the overall productivity part of it. To start this session, I would like to first introduce our respected faculties. So, first we have Dr. Anil Ganjoo. He is a senior consultant dermatologist uh, and laser surgeon, director at Dr. Ganjoo Skin and Cosmetology Center, New Delhi. He is a recipient of prestigious Dr. Sardarilal Memorial Lifetime Achievement Award awarded by IIDVL and DSB. Dr. Ganjoo has been inspiring dermatologist of the year 2019 by Economic Times. He has been president of SARC AAD and past vice president IIDVL National and past president IIDVL DSPA. He has been authored chapters in several textbooks of dermatology, cosmetology, and lasers. I welcome Dr. Anil Ganjoo for a very important for interactive session for the today's.
Thank you, Udit.
I
Thank
would
you very
like
much.
I would like to call upon our next panelist, Dr. Pramod Jog. He's a professor of pediatrics and at DY Patil Medical College, Pune, and consulted at Jog's Children's Clinic, MediPoint Hospital in Pune. Dr. Jog affiliation and have a lot of professional achievements. He has been President Indian Academy of Pediatrics 2016. He's a chief editor at Times of Pediatrics, senior consultant to UNICEF India, and part of core committee at National Polio Surveillance Project of WHO, UNICEF, and GOR, Government of India. He has been also a member of Pediatric COVID Task Force, Maharashtra State Government of India. Also, he has around 100 publications in national and international journals. I welcome Dr. Pramod Jog, sir, for a very important interaction today.
Thank you.
Thank you. Another very important panelist, what we have is today Dr. Dharmesh Kapoor. He is a DM Gastro, consultant gastrohepatologist at Yeshoda Hospital, Sikandrabad. Dr. Dharmesh Kapoor is a regular faculty at annual scientific meeting of Indian Society of Gastroenterology, Indian Association for the Study of Liver, and Indian Society of Critical Care Medicine. He has co-authored Indian Association of Study of Liver Guidelines and acute liver failure, nutrition, chronic liver diseases, and management of chronic hepatitis B and C. Also contributed to APSL guidelines on the management of acute chronic liver failure. Once again, I really welcome Dr. Dharmesh Kapoor sir also for this important part of discussion. So, to start with the discussion, we need to understand very important perspective on the knowledge gap. I think it's a very popular term, and we would like to understand from our elite panelists. In your case, it can also be termed as relation gap. How are your experience with the medical representatives visiting to you regularly in your day-to-day job? So anybody can, respond. I think we can start with Dr. Ganju. What is your point of view into it?
Well, there are all kinds of representatives that come to us. There are companies who make sure that their representatives or their people working at ground level are really efficient, they are trained well, they are communicative, they can communicate and put across their point. But there are people who are just appointed. I don't know how they appoint them, and they really can't put across the point and can't. We don't understand exactly what they want to convey. So I feel people who are employed at that level or put into that position should have a ability to convey to the consultant about the product properly, and particularly the salient points about the molecules that they are talking about. They should have a thorough knowledge. Many a time what happens when we ask them, say for example, even what percentage of this drug is there in a, for example, a topical formulation, they would not know. They'll tell us, we'll get back, doctor, after asking our medical team. So I think these people have to be thorough with their product. When they talk to us, they have to be completely knowledgeable. They need a proper training before they reach the doctor's chamber. So, but we have people, some of the companies who take care of this, and some people are really good, and there are others also.
A very valid point. I think the very important perspective in pharmaceutical representative day-to-day job is how strong their basics are about the science and the product what they're selling is. If they are having a gap, obviously there is a knowledge gap, which also increase the uncomfortable situation between the doctor's perspective and the company who is proposing the particular product. What how about Dr. Dharmesh Kapoor sir, understanding the corporate hospital where the entry of pharmaceutical industry representatives is a bit stiff and challenge, and giving the right duration of time for their proper interaction. What is your point of view into it?
So I think I would echo Dr. Ganjoo's thoughts that there are various kinds of representatives who come and meet us, and oftentimes, they've only been given one brief that you have to. It's a kind of in-your-face approach. But over the years, one has realized that that strategy does not work, and in a subspecialty like ours, which is liver transplantation, they become more discerning. So I have not had this kind of an experience as Dr. Ganjoo just mentioned, but I was remembering the days spent in my fellowship and later on in my training, that there would be some people who would just come and thrust some pamphlet in front of you, and they would just rattle off whatever was written on that without realizing that the other person probably already knows what is there and a little more than that. But however, it's in our hospital, like we have got a particular dedicated day and time in which the representatives can get in touch with us. But at times there is something which is very pressing, and if somebody has already messaged us or communicated to us, we would be very happy to receive them. So some of the people who represent the industry are also very clued in and very intelligent, and my experience has been far greater with this kind of people than the others, who would just make a visit and try to drive home their point. And over the years, the pharma industry also tends to recognize that just going to a doctor's chamber and trying to talk about their products might not be the right way, quote unquote, even to get business, and that there is something much more than that would really pay dividends. So I really quite like this term relational gap, and I think in my case at least, I have been very fortunate that this relational gap has not been there. Just if you look up the literal meaning, it means how two people connect with each other. That is what relational means, and I have been very fortunate. I and it's very well known by the people who interact with us that if somebody comes into my chamber and speaks very few words, that's probably the person I appreciate more. That's probably the person who's going to go back to his superiors and say that he's made his mark.
Very valid point. I think one more important perspective would like to know from Dr. Dharmesh. The communication skills. Sometimes medical team members doesn't have too much of broad language, basic medical knowledge. But if their communication skills are much far better, will that be additive point into it?
So I think both the two things are very important, and that is what Dr. Ganjoo was trying to allude to. So it's not just your the way you present yourself or conduct yourself and your command over the language, but it's also the content that you are delivering through whatever you are showing to the doctor and whatever you are uttering in the doctor's chamber. So I think both these two things are absolutely important.
Great. And
Can I make
so,
a point with it?
yes, yes, Dr. Neil.
I think one very important thing that Dr. Dharmesh touched upon was the number of words you speak. If you speak less and communicate more, I think that makes a greater impact. And the doctor is always impressed with a person who, conveys more, talks less. Also, I think there has to be a good body language on the part of the representative. He has to show a respect towards the doctor. He has to maintain a distance and a gap between the doctor and himself. He doesn't have to get over friendly. He doesn't have to be under friendly also. So there has to be a very delicate balance as to how he presents himself.
That's a very sensitive point, I think, because the comfort zone is something which has to be maintained, irrespective of communication or scientific knowledge what the person is having, because that builds the overall, the relationship. That's what we are talking about, and what we have, inculcated the relationship gap, meaning from the knowledge gap. Does it really also affect the practice part of your into day-to-day job? Dr. Jog, you would like to add into this? Any, challenges into it?
Yeah, actually, as I can see, most important thing is that the gap is good. Okay, it's always better to have a gap, as Dr. Anil already said. So the most important thing is that knowledge quotient. We said, let us have this term, the knowledge quotient, like IQ. May be less in case of some doctors also. Okay, and it's possible that the representatives have a greater knowledge. For example, now there is a new molecule in pediatric practice called ferropenem. Okay, it's an oral penem which has come recently, and quite a few companies are brought. And when I meet my colleagues, they say, Pramod, which is this product? I never heard of it. Okay, so doctors are hearing it from the representatives. Okay, so whether this is a good state of affairs or that's a different story. So the gap is essential, and that could be, in the knowledge from both the sides. That is one. However, we must understand that for every doctor who is a busy practitioner, a representative or his colleagues or seniors are no doubt an intruder. He's an intruder. So we would like to see the patients. So when we have a look at the OPD, then we think, "Hey, aa gaya, abhi, isse to baat to karni padegi." So that is what goes on in our minds. So in case if that particular image has to be changed, then the gentleman who is coming to our clinic has to have his own image as a knowledgeable person. Okay, and for that the rule of ABC is important. He has to be accurate, brief and clear. Okay, he has to be accurate, brief and clear. So अगर लगातार गपशप करता रहता है 5 मिनट 10 मिनट, तो फिर डॉक्टर जोग इज थिंकिंग साला ये कब जाएगा सामने से, so that is something which should not happen. Secondly, as I would just summarize what Dr. Anil and Dr. Dharmesh said, the need for the gentleman to understand as to what is the status in which Dr. Jog is sitting in the chamber. In Hindi, I always say a person who is talking to somebody in front must know certain things and follow certain things. राज क्या है, आवाज क्या है, अल्फाज क्या है और अंदाज क्या है. So what is going on in the mind of the person in front? राज क्या है? What is the type of speech that the gentleman has? Alfaz is the words and andaz is the style. Okay, so all these have to be inculcated. So when we think of communication skills, okay, maximum communication is, of course, as we all know, it's non-verbal, and then comes the verbal. Okay, so if he just comes inside casually, and then we find that the body language is not good, and then whatever he speaks may not be that effective. Okay, and the word speak is also important. Okay, the word speak has 5 alphabets: SPEAK. So whenever we speak, even as a speaker, when I go, I follow, it must reflect my sincerity, personality, experience, authenticity and knowledge. Okay, so all these 5 are very important in communication. So जो सामने बैठा है, the one who is sitting in front of you, he must get an impression, साला ये authoritative बोल रहा है. He has experience, okay? He has lot of knowledge, and then the respect that develops will, be at the back of my mind. So when this fellow comes next time, then I will be happy to receive him. Okay. ऐसा नहीं कि पहली बार लगता है साला अरे क्यों आ गया, ऐसा नहीं. Oh, good that he has come. We have some people coming from the vaccine industry. They are very knowledgeable. Okay, they have been trained very well by the vaccine pharma. In fact, many times when we have some symposia, we discuss it before the programs. So there are different dimensions to this, and I think we should consider all these points when we discuss. Thank you.
Yeah, I think bang on. I think Dr. Pramod Jokes are clearly define the speak particular section where every single word has a meaning, and how, as a pharmaceutical representative, everyone should understand this importance part of it. But in the current way, what we see after the pandemic, this digital transformation has absolutely changed the way of communication. Now, what is your perspective when it comes to the personal meetings versus digital connect? And what are your take on this, Dr. Ganjoo? I think on day to day, being you are into the clinic settings where you have a lot of interventions between the patients and continuously with pharmaceutical representatives. What is your best method, and what currently you are imbibing it?
You see, in the digital, era, which has been thrust upon us, there are several ways the company guys are getting in touch with us. There are just message communications. There are sometimes video communications. I feel the messages go into the spam. We never ever open those messages. In fact, as soon as we see a message coming from a medical company guy, that might be an important communication to me, but I'll not open it. So one is that I don't think that makes any impact at all. But there are some companies, who take an appointment and tell us, sir, could we connect at this particular time? And then those guys will connect on a video platform, like we are talking to each other. They would connect on a Zoom or one of the video platforms, and they'll properly do what they do in an in clinic, representation. I feel that is very effective, and in fact more effective than what we used to have when they used to come into the clinic. And in the clinic, as Dr. Jog sir said, we generally have that feeling here. We have had a difficult day at work. When will this guy leave and I have to rush to the next clinic or maybe home? Here we are at ease. We have given them a time of 10 p.m. Okay, I'll be free. You can get in touch. Seems to be a very effective way of communicating. But the messaging, I think, is more or less useless.
Understood. So, Dr. Dharmesh, I just want to check: should we have a day or particular timelines if you are like really comfortable in, let's say, in terms of digital connect with the pharmaceutical representatives, or should we have a mix of it, a physical and a digital mix put together in the current world?
Is that for me?
Yes, Dr. Dharmesh, for you.
Yeah, so I think what Dr. Ganjoo said is really what I feel about this whole thing too. So at times somebody from the industry can just connect with us or ask for permission that they want to discuss a particular thing, and for me that's very important that the agenda should be set right at the beginning, so that and it's and both the other two panelists have already alluded to this, that it's equally important for the doctor to know what is going to be discussed as for the person from the pharma industry. And at times, like in the last 2 years, there have been new therapies and new treatment options that have come to the fore every now and then, and it's always good to go prepared for a meeting like this. So if there is a kind of a web-based communication, I always prefer that. And of course, you would say yes to a given meeting only when you have known the person on the other side for some length of time. And like I said, at the expense of repeating myself, in the specialty that I work, there are very few players, and therefore it's a kind of a comfort level, and I know who's wanting to get in touch with me and for what reason, and therefore this whole thing becomes easier. So the short answer to your question is that yes, both personal interaction and web-based interactions are important. And web-based interactions can be more detailed, where you can have a number of viewpoints coming in. At times, there will be 2 or 3 of my peers, my colleagues who would also be connecting. And I think that also serves the industry's purpose well, so that you can crystallize whatever you've heard, or you've participated in a discussion like this. So I think it works well both ways.
Fantastic. I think, say in that, if we see a digital connect is something which is more objective related discussion, because you are taking a specific time for a doctor discussing something which is relevant, but we cannot have the regular intermittent calls generally what medical representatives does every day on an average to remind the doctors about the brands and all. So I think there is a thin line difference in terms of the objective oriented discussion in the digital perspective rather than in the physical perspective. Dr. Jog, what is your point of view into that?
Yeah, I feel that the digital connect involves getting connected, then giving a dedicated time. Then the fellow says that now my manager will speak to you. Ultimately, most of them, they want that the product should be promoted. Okay, and then
Mhm.
if everyone starts doing this, then I will lose all my family time and leisure time. Okay, so many times I feel it's if बंदा direct clinic में आता है वही अच्छा है. तो बार बार मुझे लैपटॉप खोल के या मोबाइल खोल के बैठना पड़ेगा. आई विल हैव टू सिट लाइक दैट. सो दैट इज समथिंग which goes inside my mind. Okay, now the
Mhm.
point is, even during these digital connects, the fellow who is speaking to me has to be well read. Okay, so that the time which is spent by Dr. Jog in interaction has to be a quality time with that person. Okay, there he should not unnecessarily discuss about sir iska ye comparison mein isse ye acha hai, iski efficacy अच्छी है. Then it will become a big problem, and these should not be frequent, maybe once in a month. Okay, that should be okay. And if there are some exclusive products where some discussion is required, then this digital connect would be okay, because in the rush of the OPD many times we are not able to give enough time to the academic part of that. Okay, so I feel that one-to-one communication, or maybe sometimes we have those CMEs being organized by those companies.
Yeah.
So there, over dinner, we can also learn some of these things, wherein the real perspective should be put. That means, suppose there is one product which is being rather promoted by that pharma, then there will be some, say, 10 or 12 good articles, Google Scholar
Correct.
articles. Okay, so all of these articles should be reviewed. Okay, and then that particular product should be put in the perspective of those different articles. Okay, otherwise many times we get a biased perspective of that product. Just as
Mhm.
in the entire article, the highlighted points may not be the real crux of that article. The highlighted points could be the ones which are convenient for the company. Okay, so it will be difficult to judge when we are having a digital connect. But when it is amne samne, I can always ask for give me the full text article, whatever you are
Yes.
speaking. Okay, so
Yes.
there are different perspective to this. And if it is not a waste of time, a brief communication again would be appreciated, provided the person is well read, intelligent. And see, there are general practitioners also. Now today Dr. Pramod and Dr. Anil and Dr. Dharmesh are here. We are, say, consultants, okay, or maybe super consultants, whatever it is. But then
Mhm.
there is a huge ocean of general practitioners, who would probably appreciate that the representative gives them the knowledge, because there the
Absolutely.
knowledge gap is going to be huge. Okay, so I would personally feel that the information provided by the representatives has to be extremely authentic. And for that, maybe say a few of us can have a panel of consultants for that pharma. Okay, and we will decide the matter to be further, given to the general practitioners. So let it be censored by
Mm.
the experts in that particular field, so that proper education, proper medical education takes place. This may seem difficult for those pharma companies, even in case if the product is not up to the mark. But then those who are really centered around the quality would probably appreciate that the literature which is being circulated has been scrutinized, has been really edited by experts in that field, and then it is
Yes.
percolating down to the society. Of course, that's my personal view. Maybe you can all contribute your views on that.
Yeah, I completely agree with you, Dr. Jog, because there are a lot of variety of points which has to be taken care of in terms of making digital connect a very valuable discussion point of view. But when
So,
it
so Mr.
in a
Udit, can I just chip
yes,
in? The one of
yes,
the other advantages of the digital communication is that it is not just the representative whom you are interacting with. So, oftentimes when you have these web-based short
CME.
interactions, they don't need to be very detailed. Not
Mhm.
about the length of a CME, just 10 minutes enough to discuss. And over here they will be having their medical advisors, their medical monitors, their key medical liaisons. So it's not just the representative that you are interacting with. And I think my take on this is, rather than talk of a molecule, we should talk of therapy. So that would
Absolutely,
put that molecule in perspective. And like Dr.
absolutely,
Jog said, that it's not about trying to promote a given molecule, but to just highlight what the current situation or current position of that molecule would be in the therapeutic armamentarium. So I think
absolutely.
that is one distinct advantage of a web-based interaction.
Yeah, guidelines perspective and overall the disease management is the ultimate task. Absolutely fine. In terms of digital transformation, we have seen also in the excessive content flow of medical content. We have seen now, as a medical practitioner, we see that there is when there is an excess flow of medical knowledge coming to you from different pharma industry perspective, how you want to see that it should be you coming to you it should be in the systematic way, like the way you want to see, and how much frequency you would like to see into that, so that there is a flow of medical information to you, but it should be in a very constructive and streamlined way. So what is Dr. Anil Anju you would like to say upon that in terms of dermatology perspective? Now we see a huge disease advancement in treatment. Say, for an example, in skin diseases, psoriasis, one of the place where a lot of advancements in treatment is happening, and we see a lot of companies are entering into it. But in that section, when you have multiple flows medical knowledge coming to it, how would you rate that this particular knowledge is better, or I'm keep listening and reading to it, and at what frequency you would like to have from company perspective or from any medical association?
Again, the content transmitted or presented should be very precise and should, convey the points very precisely. The latest scientific data should be picked up and tried to present before the consultant, and this can be followed up. You see, they can tell us about what has been the recent developments, what has been the recent studies on particular molecules or particular therapies, and then they can give us the salient points of a particular research, and then they can follow up and transfer to us the articles that are related to what they have presented to us. So that would be
Mhm.
a good way of scientific way of doing it. Again, the communication skills would be very important here. They have to be, what they are presenting, they have to be short, crisp, precise enough to convey the point, and then that can be followed up with transferring the full articles for the consultant to read and go through and understand the full this thing. I think more than presenting their own product, that can subtly be done. More
Therapy.
of scientific, data transmission would be better. That impresses the consultant more. That strikes a point better with the consultant rather than just talking about a brand and telling about only the brand.
Because in the current world we have seen a lot of new tools have been absorbed in the market. Let's say email marketing system, we have seen WhatsApp marketing system. All these marketing systems are well observed now and well adapted. Now point is, how frequently you want to see, if suppose the content is very good, interactive, how frequently you would like to see such kind of updated in your medical knowledge coming to you from the pharmaceutical companies, because
Not
your
frequently at all.
okay.
Not frequently at all. You see, it has to have a gap. We have a personal life, we have a busy practice, so we need time for ourselves. It has to be a perfect balance. You don't have to overdo it, and you may not underdo it. So a company may approach and do a digital Communication maybe once in 15 days or once in a month, not more than that. Otherwise, it would become too much.
Very valid. Any perspective from Dr. Kapoor sir on the frequency?
So I think, yes, you don't need to go for the overkill, and it's not as if that there is such an explosion of knowledge that you have to keep bothering the consultant every now and then. And like I said, that you should be talking about the problem that you are trying to address, how that particular molecule fits into the picture. I am very impressed by those pharma colleagues who talk about the adverse effects and the Indian experience, and I would actually get swayed by that rather than who keep telling me that this is the utopia for this particular condition. So I think that sense of balance has to be there. You need to allow the consultant to draw his own conclusions, because it's not as if that the consultant would be only knowing about that
Yeah,
molecule. The consultant would be knowing probably a little more in that therapy area than the person who's talking to him. Of course, there are new things, and you would have access to, say, stuff like data on file. And you know that many of the innovations happen in the Western world. At least in the last 2 years, a number of times I had to talk to the colleagues in the pharma industry to let me know whether there were. So, like I deal with transplanted patients, and when you have to use the drugs that were used during the COVID pandemic, it was very vital for us to know whether there are any drug-to-drug interactions. And oftentimes, they will not even be reported in literature for want of that experience. So one would have to turn to pharma colleagues and ask them whether there was data on file available about a given situation. So I think
correct.
this is really vital. But like my colleagues have said, that it's very, very important that you should not just be focused on the molecule. You should be focused on the patient.
Correct.
So it should be patient-centric discussion.
Absolutely, absolutely. But another important stakeholder in our overall cycle management is patients, where we see there is an absolute change in the behavior or change in the footfalls. How this digital transformation has changed, and specifically during the pandemic time, specifically like Dr. Anil Ganjoo, what is exact one thing which you will and to iterate specifically? How did you manage your patients, specifically coming for the follow part in the pandemic time and the current status? How did you manage exactly? So, would like to know about that.
See, we don't have an emergency kind of a practice. We as dermatologists, it's the disease aspect in dermatology is not that extensive. We have a lot of cosmetic dermatology also, which can wait. So it waited in the pandemic. But yes, then there are emergencies. There are things that we need to look at. So then video consults came in at that time. Although the number of patients we used to see was much less than what we normally see, but yes,
Mhm.
then we had when we had to, we would do video consults. In fact, video consults have now creeped into our practice, and that has become a part and parcel of our day-to-day practice now. Although we have opened up completely, we are in our clinics all the while. But then, because patients are also getting they know the ease of getting to the doctor through video consults, so that has come and it has stayed, although it's not as much as it was during pandemics. But we used to do lots of video consults at that time. We are still doing.
And when it comes to the dermatological indications, where we see patient needs to be watched properly, specifically the skin areas and all, in terms of flares and kind of severity into it. So, do you believe that regular follow-up of the patient coming to the clinic is important, or from the video consultation also you can maintain that point?
No, video consults have their. It's a compromised consultation as far as our practice is
Mhm.
concerned, because our diagnosis is based on the visual, impact that the visual impression of the lesion that we see. Unless we see the patient properly, we feel the skin. There are so many things that you can't do on a photograph or a video. Video consult is totally useless. In fact, we do see photographs, and many times we can take care and do a
Mhm.
compromised consultation. It's a compromise. A physical consultation definitely is much superior than a video consultation or a photographic consultation. So there is a compromise, but it had to be like that during the pandemic. Now we prefer that the patient should come to us as far as possible, particularly if we are a little doubtful about the diagnosis. We would like to see the lesions by our naked eye, and then
Mhm.
feel the lesion. It's very important to feel the lesion in our practice.
Absolutely. Absolutely.
That helps you, not only to diagnose but also to develop a better connect with the patient. Once you feel the lesion, the patient feels that the doctor, they get a emotional connect also with the doctor by that. So nothing can beat a physical consultation, but then if you're forced to, then you have to go to a digital consult.
Fair point. I think it's absolutely correct. Dr. Jog, in terms of treating childs during the pandemic, specifically vaccinations, where class of kids who are into the vaccination duration section, how did you manage to make sure that their proper vaccination has been done? They are not, having any kind of gap into that. How did you manage any planned way or like some home visit? Would like to understand from your point of view.
Yeah, it's a very important area actually. I will tell you, during the pandemic, the percentage of immunization has gone down drastically. And for people, immunization as it is not a priority, in general. For them,
Mhm.
I will tell you, in the first year of the life of the child, everybody is interested in the child. Okay. But after first
Yeah.
year, the interest of the father slowly wanes off. Mother somehow manages the child. If she is working, then she also starts, handing over the responsibility to doctors. So they want doctors to remind them sometimes. Okay. So the days are changing. But immunization has suffered a lot. People were afraid of coming out of the society.
Correct.
If they used to come out, the watchman or the security would obstruct, the policeman on the road would obstruct. Some of them had a fear whether in the clinic there would be somebody with COVID and my child would catch COVID and all. Okay. What we did as a rule within our organization is that we decided to send them the text messages to remind them of the immunization. But that we did only once. Okay. It should not appear as if Dr. Jog is after the parents to just get him for immunization. So only one message, that was something which was done. Of course, the percentage had dropped. It is still taking a lot of time, for the percentage to pick up. Percentages, I am speaking of the entire community, and even in my
Hmm.
personal practice also, it has definitely gone down. So now, when the newborn is there, that particular newborn, now we are tracking. Okay, so we have prepared one a system wherein we put the name of the child who comes to us maybe in the first month of life, and then we tell
Hmm.
him that, "See, this is the date when you are supposed to come." We do have those immunization records and the files and all, but some of them, they still need to be reminded about it, and people are still afraid of coming out when there is something, like a pandemic going on. And maybe in response to what our colleagues have been speaking, I think this telephonic consultation, which Dr. Anil was speaking, is very important. And that was a situational compulsion. Okay, the situation was such that for the first aid, people used to consult the consultants. Okay, for getting the immediate relief. But many times, for those babies who are under the age of 3 months, where we are unable to make out what is the problem, some child who is breathless, we don't know whether he is hypoxic. We have to see that particular child personally. So all these things are important. So in a known patient, okay, it's okay. I know, I have seen this, and now he has a acute attack of asthma. I can always ask him to take an inhaler or
Hmm.
do something or the other. But for an unknown patient and a child who is under the age of 3 months, in our practice, it was a bit of a challenge for me. Now the telephonic advice is only water. For fever, it is tepid sponging with water. For cough, it is warm water with honey. And for gastroenteritis, it is salt, sugar, and water solution. Okay, so beyond these three situations, I don't give any other consultation on phone. So water is the only thing. Okay.
And I think very valid point. Water has a lot of things which can be helpful in terms of maintaining the patient's profile. That's very important. Dr. Dharmesh, understanding the your practice where you see a lot of immunocompromised patients and have been dealing into transplant related patients, how you dealt upon such kind of patient in the pandemic time, and any kind of systemization you have done if in case any such scenario will again rise, then how you make sure that the patients are well taken care of?
So I think the beginning of the pandemic was really a very scary period for us because the knowledge about what happens to people who are on immunosuppression was not there, and this was the experience
Mm,
worldwide. So as you
right.
know, come March 2020, the transplant activity in most centers across the
Right.
world came to a halt, and it was only over a period of time when you realized that there were certain patients whom you could not avoid transplanting because they were so sick that and there was no knowledge as to when this pandemic
Mm,
is gonna
mm,
end. And like my colleagues have said, I was really very scared of telephonic communications because many of the patients I deal with are very sick, and oftentimes it becomes very difficult to give any opinion over the phone, or even if it's a video consultation, because quite a few times these patients are so sick that they probably need to be clerked, touched, examined, and then only you can write a proper prescription for them. But as time passed by, we realized that there was a dire need for the patients not to come to the hospital. So in that particular sense, we started a kind of a focus group in our practice, in our transplant program, wherein the patients would report in with their numbers, with their symptoms, with their x-rays and imaging done locally, and then we would take a call whether they would need to come to the hospital or not. So it was seen that if you had an intelligent relative or an attendant with the patient, those were the ones who were more likely to survive. And those who
mm,
panicked and wanted to rush to the hospitals were more likely to succumb. And it is not that they were catching infections from the other patients who were infected in the COVID ward, but it is just that in our practice, we realized that you didn't have to stop the immunosuppression except for a few drugs, the anti-metabolites. The patients could be very safely managed for a short duration of time just on corticosteroids. So it took us a little while, but not a huge length of time to realize that these patients could be managed well with good graft function. And even if you were, but you had to be on your toes. So me and my team members were working almost 24 into 7, and the endeavor was that only that person should come to the hospital who needs organ support. So I think that was a very insightful period for us and a huge learning experience. But now that the knowledge has crystallized around how to manage people who are on immunosuppression, we become much wiser. I don't hope that such a pandemic ever happens again for us medical professionals, but there has been a lot of knowledge that has been gained through what this virus did to humanity.
Thank you so much, Dr. Dharmesh Kapoor. Last question, I think, is after that we will have the questions from the audience. What is the message to the pharma industry, Dr. Ganju? One
I
message you
think
want.
we have time and again reiterated it. Effective, short, crisp communication, a good body language, a good attitude, a respectful attitude is, a summary of what they should be to the doctor.
Thank you so much, Dr. Kapoor. What is your message?
Yeah, so it's pretty much the same. You need to be very focused in what you're trying to put across. So you should not just be rambling whatever comes to your mind, and be respectful and mindful of the fact that the person who's sitting in front of you has got time constraints, and you need to put forth your point of view in as few words as possible. And oftentimes it just helps to leave behind some relevant literature and let the doctor decide on his own, whether there is any merit to the molecule that is being spoken of.
Yeah, very valid. Once again, same thing that knowledge is something which has to be consistently flown from farm industry to the medical practitioner, but it should be qualitative, focused, objective based orientation. Dr. Joe, any further addition point you would like to add apart from what Dr. Ganju and
Yeah,
Dr. Kapoor said?
see, I always feel that the medical rep who comes to my clinic is, doing it for his own bread and butter. Okay, so usually I do not shout on them. I do not, speak anything against the product with him, because he is only a
Mm,
messenger of the
right,
company as far as the product is concerned. The
right.
poor chap is coming to me and detailing the product. I give him patient listening for 30 seconds, 1 minute, and say, okay, thank you, I will do the needful. Okay, the point is that it is a symbiosis. Okay, it is what I would say, he's a catalyst, to transfer the information from the pharma industry to the doctor. Okay, and I should look at it in that particular perspective, that he's trying to tell me something from the pharma industry. People have researched one particular molecule, maybe a bit of a biased information, but he's trying to give it to me, of course with the motive of promotion of his product. That goes without saying, that's okay. But the point is that this symbiosis should be made of a good use of. Okay, so when I attend a CME and give a talk, why I go? Because these fellows have taken all the efforts to organize a CME. They have booked the hotel, they have arranged for these delegates invitation cards, and so many things. They have, the groundwork has been done, which Dr. Zog would not have been able to do it if he wanted to transfer his knowledge to the other colleagues. Okay, so
Mhm.
I think it's a symbiotic activity, wherein the rule of 80-20 is known to everybody. If they have 80 things good, 20 would be here and there, which I should be ready to accept. I might have certain things which are deficient in me. Okay, or I might have some good things in me. So I think we should look at it as a combined symbiotic approach, and particularly those who are well read, professors, seniors, super consultants, it is their duty to even train these representatives and the pharma as to what are the priorities which they feel. Because how this gentleman is going to come to know that this is important in Dr. Zog's practice, or in Dr. Dharmesh's practice, or Dr. Anil's practice. Okay, so it is my duty also to guide them to come out with
Absolutely.
information which is really really needed by the people, and some basic information to the general practitioners at the periphery. So I think it is a two-way communication, wherein it should be a win-win situation. Okay, that's my view about it.
Absolutely. I think it's a mutual industry flow of the medical information, and it is dependent on the attitude, skills, how you behave. It's all about this cycle of treating the both of the stakeholders in a proper way. That's very important. Now we will have some very interesting questions coming from the audience, so that we are at the last phase of our discussion. Very interesting question. I think I would like to ask from Dr. Anil Ganjoo. Do good pharma products really need marketing?
Uh, Yes, of course. At least until the doctor develops confidence in them, and the advantages of that product, the points that favor that product, that particular brand over the others, has to be communicated, and then the doctor will try out for himself. And then, if he develops full confidence, I don't think thereafter you need to do it again and again. He needs to be reminded, of course, occasionally, but if he develops confidence in a product, then that's a point when the pharma industry can be a little at ease and let it flow from the doctor, because doctor will always prefer to write something that gives relief to his patient, no matter what other factors are. So I think a good product definitely needs lesser promotion at a later stage once the doctor has developed confidence. But initially, of course, you need to tell the doctor about its advantages and its points, us what do you call, unique selling points, USPs. And once the doctor has developed the confidence, I think then you can take it easy.
Absolutely. Marketing is all about how you create right positioning to your right consumers. And if you create a right positioning, you have a right eligibility in terms of where to this particular product to be used upon. And consistent noise level has to be there to have a consistent knowledge spread, not only to the stake value doctors where you are approaching to them, but all across the medical faculty wherever it is required. That's a very important phenomenon. Another important question which has been from Mumbai is, should or does the responsibility lie on big reputed KOLs in bridging the gap and organize more events, ground and webinars to share the knowledge? Dr. Dharmesh Kapoor, what is your point of view?
So I think in the last 2 years, there's probably been a lot of such initiatives taken by both KOLs. Of course, like Dr. Jog said, that it's impossible just for the KOL to organize big events like this. We would need industry inputs as well as the logistic support to organize an event like this. But in recent times, I have seen that the attendance into these webinars has been dwindling because we are discussing the same subject over and over again, and probably initiated by different pharma houses. So again, that is something that one needs to be very conscious of. You can't be wasting the KOL's time. And at the same time, I've also seen that people would just log in so that it's realized, or it's thought that yes, they are pretty much attending, but they would be doing something else. So these are the two things which have really made me go away from webinars in recent times. I would much rather have just 5 or 6 people in the room listening to what I have to say, but I would like that to be interactive. So those are the downsides of web-based programs. And of course, they can be initiated by the KOL with adequate support from the industry.
Thank you so much, Dr. Kapoor. I think it's a very wise saying about the perspective of dissemination of knowledge through all kind of connects. Another question we have it: how about the MCI guidelines regarding physician and pharma interactions? Does it not hamper the new drug launch and using the benefits of the patients? Dr. Joe, you would like to add one into it?
Yeah, actually, the guidelines are now well known, and they are about the freebies being offered to the doctors. Okay, and personally, I agree that there shouldn't be anything in excess. Okay, in all walks of life, freebies are given. Okay, so many of my non-medical friends say, प्रमोद ये क्या तुम्हारे मेडिकल प्रोफेशन में चल रहा है, हमारे यहाँ तो इससे भी आगे बढ़कर बहुत कुछ रहता है, so you are worried about small little freebies. So I personally feel anything in excess is bad. Okay, now for example, there is a child who comes to me for first episode of convulsion. Okay, I find that this is epilepsy. Okay, I should not straight away send him for a CT and MRI. Okay, so this should not be the attitude. The attitude should be where indication is there. Okay, so if it is really needed, things are okay. But then for the pharma to go hand in hand with the medical community, it is always better to be balanced. Okay, I always feel that doctors are not that poor that they need to be taken to Mount Abu or to some hill station for 2 days with the family. And these our doctors also fall prey to it, particularly in the younger ages. When they feel that this is something which lures them. Okay, and then these bring up the problem. So anything in moderation is okay. It's a part of gratitude. And further discussions will of course go on about this particular
Mhm.
aspect. But then it is up to the individual personality of the person. Our senior teachers, they never accepted any sponsorship from the infant milk formula companies, and then it came up as a law called as Infant Milk Substitute Promotion Act, and so on and so forth. So things go on, but sometimes we have to be balanced, and I think in life everywhere this balance is important. So I hope the concerned authorities will definitely look it from different perspectives. And in case if a meeting is arranged, if the doctors are invited and the speaker is remunerated for the efforts, I don't think there is anything bad about it, because someone is taking extra
Yes.
efforts preparing a presentation, giving his time for the audience. The audience may not be rather given anything, but then they are getting a good amount of knowledge from an expert. Okay, so
True.
organization of CMEs and involvement of different doctors, I think some of these things need to be rather charted out properly. However, I personally feel that there are different ways. I don't know as to how much time we have, but there are certain ways in which this particular gap can be bridged. Particularly, there are two or three areas. One is the training of the nursing staff in the hospital. Many times they need to be trained about observation of a patient in the hospital as to how it is done. We are well trained. We have so many CMEs, but nurses do not have any programs. Second is, of course, training related to practice management. Many of
Correct.
us are not aware as to how to manage the staff, the human, resource, and then the material in the hospital. Okay, so there are other so many areas. Probably we could not have, rather we have not discussed the innovative ways of going ahead. But then there are certain areas where we need to really consider some aspects where a doctor wants to do something, but he is unable to do that. He wants to manage his stress, but he is unable to attend a 2-day workshop at Lonavala for stress management. Okay, here, the doctor could be definitely assisted by the pharma
Mm,
for
mm.
by payment of a subscription. He can go and attend if he is having some good hobby. These are, as I said, these are mutual, catalytic, and symbiotic things, and they have to be taken in a proper perspective without overdoing anything of this. Thank you.
I think it's an
So,
evolving
so,
topic.
so, Mr. Udit, this particular word freebie, it does not. It actually it's. I would say in this current discussion, this sounds a little disdainful, for want of a better word. So all over the world, if like Dr. Jog said that if you are putting in your effort to put a presentation together, or you are taking time out to address a gathering, maybe it's practitioners, and maybe they would be referring cases to you, but that is an
Yeah,
effort for which you must be paid, and that is, it could be in the form of a remuneration, or it could
correct.
be in the form of, say, me telling you that, okay, I want the CME for my nursing staff, for my physios, for my nutritionists, so on and so forth. So I think what we need to be mindful of, including the MCI, is that every doctor should have a kind of a disclosure slide before his presentation, which has now become a norm, at least in the specialty that I work in, and wherein you have to, even for the publications that we make, we have to sign a disclosure form, and that
Yes,
includes whether you are you are on the speakers bureau, or whether you are on the advisory board, or whether you have received some kind of a research grant from the industry, and all those things should be highlighted. So the important thing to remember is that you are not writing a product just because you have an association with the company. So that is something that we need to really respect. But I don't think there is any harm in pharma industry remunerating a doctor for his time and effort. I see nothing wrong in that.
and that's a noble statement, because I think every single minute invested for knowledge dissemination, we believe it has to be remunerated. There is no doubt about it. I think, lastly, I would like to ask Dr. Anil Ganjoo your point of view on this.
Well, I feel you see there's a lot of skepticism amongst our fraternity as to what will happen. How will our CMEs? We are doing CMEs almost every week. In fact, I am now in one CME and I've taken time off for attending this meeting. And it's very important to have these CMEs and transmit and knowledge and learn from others as to what they are doing, how they are. So. I think if we can convey to the authorities, they need to look at this in a very balanced way. Maybe they can put restrictions on something that's not done overboard. They can develop guidelines, but they have to look at this at a in a more mature perspective and understand that this is the need of the medical fraternity. We have to communicate. We have to transmit knowledge. We have KOLs like Dr. Jog, Dr. Dharmesh, who have to transmit what they have learned all their life and what youngsters want to hear and learn from. So if this is not done, if a total ban is put on all these activities, I think our fraternities will become redundant, and we'll have nothing to learn. We'll have nothing to look forward to. How do we move ahead and provide our patients with the care and newer therapies that they need? So I think they need to look at it in a very balanced way, develop guidelines so that things are not done overboard and unethically. But whatever can be done ethically has to be done.
Yeah, absolutely. I think new evolve. This is a very evolving topic as of now, and whatever the current guidelines has been talked about, any kind of time involved by the HCPs have been properly remunerated, and there is a clear transparency coming out of it. I think within a couple of months, it will be well streamlined, and the informations will be properly taken care of. There is no ambiguity coming down the side, but still, a lot of clarities which should come from the government point of view is something which is really relevant for all of us. That's the ask of the matter. So I think we can close this session, because it's a wonderful session. We had interacted with you, all senior faculties. Thank you so much for your time, because everyone is today is a Saturday, and but still till evening you guys are like absolutely packed up with your important commitments to your medical fraternity and to the patients. Thank you so much for your time once again, Dr. Pramod, Dr. Dharmesh, and Dr. Anil, for giving us a lot of good feedbacks. What are the interventions? What are the key gaps, arrangements, which to be taken care by pharmaceutical industry to make our relationship better, stronger, and healthier? And we should pursue that. Coming days will be much better, productive, and will have much innovative way of dealing into digital transformation. Thank you so much once again. I think pleasure to talk and once meet you all in future. Thank you so much. Thank you so much for watching.
Thank you, Udit. Thank you, Dr.
Forward.
Jog, sir. Thank you, Dr. Dharmesh. It was very nice interacting.